Much for joining us today, Dr. Coppelson. I truly appreciate it.
My honor to be here. Excited to talk with you and see where the conversation goes.
Yeah. So we're gonna jump in and I'll just warn our audience now. I've already warned you that I will slaughter a couple of the phrases here. I've been practicing all day, but I'm just not so great at them. So just hang in there with me, everyone. So the first thing I want to talk about, because of your specialty, I want to talk a little bit about jaw positioning
hmm
and why it's so critical to, the overall health of the patient, and the way they sleep.
Yeah, really great point. There's, I'd say, an epidemic going around right now with, modern humans and our jaws being too small for our mouth. And the result of which has been pretty detrimental to the way people breathe and sleep. There's obviously signs of it that we see with crowding. How many people need orthodontics? They need to get their wisdom teeth out. They don't have enough space in their mouth for all their teeth to erupt normally and straight. Um, on a very mild end, you get some braces, get your wisdom teeth out, and hopefully you're functioning okay. But unfortunately, for a lot of people, when the jaws are small, it can really affect the way you breathe and sleep. You don't get enough space for your tongue. The nasal airway volume is narrow, so it becomes harder to breathe through your nose, and you become a mouth breather, at least partial of the time. You have increased airway resistance, which can lead to conditions like snoring and UARS and sleep apnea. So it's a huge epidemic. It's really exciting to see people um, kind of waking up to it. I feel like it's becoming vogue, which is a really good thing because
Mhm.
people are, going to podcasts like this, they're reading books, and they're kind of becoming attuned and aware to maybe something that they've been suffering with for years and years and years, or seeing it in their child. Like, hey, maybe it's not cute that my little kid's snoring. And,
Right.
definitely the best time to intervene is when someone is young, and then hopefully they'll never need me when they're older. But I guess maybe some of the things we'll highlight at some point in this conversation is um, we are living in a golden age of treating some of these jaw issues, whether the jaw's not wide enough or hasn't gone far forward enough, or there's other issues in the orientation and jaw development. We're living in a real golden age of the way we're able to treat those conditions, even in adulthood, but definitely catching them young,
Is better.
treating it, like we say, treat the smoke before it turns into a big fire. Uh,
Mhm.
but yeah, no, huge issue. The
Right.
jaws are definitely the gateway to the airway, so
Right.
it can be a big problem.
Yeah, everything starts here.
Mhm.
And you touched on it briefly, and I just kind of want to back up to it because um it can't just be all Gen Xers. I'm sure there were groups before us, but from Gen X down, at least, it's kind of a rite of passage to have your wisdom teeth taken out.
Mhm.
You know,
I remember
Uh,
when I was young, I was excited to get braces. I was like, I can't wait.
isn't that wild? That's so crazy. And it's so funny. Mine came in completely straight, so
Yeah.
I missed that um, late teen, early 20 wisdom tooth pull. I was one of those. Oh, you're in your 30s. Oh, let's just go ahead and take them out. Why not? Right? Because they're getting in the way. And it wasn't that I didn't have enough space. They was bumping into things up here, blah, blah, blah. But that still kind of plays into what we're talking about because if my jaw were the way it was supposed to be, those little straight puppies would have stayed in, right? I mean, we don't have to have our wisdom teeth out technically.
Yeah, technically, you should have jaws that are big enough to support 32 teeth, fully straight, fully erupted, fully functional. Yours may have came in straight, but they may have maybe been partially erupted, and you
Mm.
couldn't clean well behind your second molars, and it was becoming a plaque and calculus trap that was leading to periodontal disease, or whatever the reason was your hygienist or dentist recommended to get them out. Um, but yeah, I mean, what percentage of people end up needing to get their wisdom teeth out? It's super
It's
high,
huge,
right?
isn't it? Yeah,
Most common
right.
procedures we do in America. And it's not normal. I mean, if you look at ancient skulls, I say
Hmm.
non-modern skulls, even 500 years ago, um, healthy adults had 32 erupted teeth. They had straight teeth. They did not have braces back then, and in a very short period of time, faster than evolution can explain, our jaws shrunk, and we're ripping out wisdom teeth. We're putting people in ortho. In really sad cases, people are pulling even premolars and retracting everything even tighter. And, you know, in 10, 20 years, those are the patients we're seeing that are having a lot of airway issues. I mean, when I was a kid, I had retractive headgear. I look back and I'm like, oh, if I could,
Right? If I
if I
just
could go into
knew.
the fifth dimension and go back in time and,
I
fix
think
things.
we've all had that moment, right? Even hosting these podcasts, there are so many times I have to follow up with my kids. I'm so sorry. I didn't know. We
Yeah,
didn't know.
we didn't know.
We just didn't know
We-
at the time.
Yeah, your parents were doing what they thought was best for you, which was getting you
Hmm.
braces and you got to get your wisdom teeth out. The orthodontists were doing what they were trained. I'll tell you, like,
Exactly.
now that I'm an airway focused oral and maxillofacial surgeon, um, most of my learning happened on my own, right? Like, you're trained to take out wisdom teeth, you're trained to do jaw surgery, but no one kind of puts the puzzle pieces together for you and is like, well, why are we taking out so many wisdom teeth? And, why, I think a lot more people need jaw surgery than get it. That's a whole nother discussion. It's not like a surgery. It's not as simple as taking out wisdom teeth in any ways, but there's a huge epidemic. I mean, even if you look at nighttime bruxism, right? How many people clench and grind,
Hmm.
develop temporomandibular joint disorders, pain in their masseters, wearing away of teeth. That's another crutch. That's another symptom of not breathing normally and easily in sleep. So, I mean, these things have, people react differently, right? You have the
Right.
sleep apnea patients, you have the clenchers and grinders, you have the UARS patients who have tons of microarousals and they don't go into deep normal sleep architecture. And, everyone kind of reacts differently, but it's all due to the same
It all
anatomy,
comes
the
back
jaws
to the
being
same
too
root,
small.
though. Yeah,
Yeah.
just not working.
Hmm.
And I had read something, and I don't know if this is totally accurate or not, but that you see more TMJ cases in women or young women. Why more? I mean, we're all having the same airway issue. Why is it
Mhm.
presenting that way? Does anyone know?
I don't think no one knows why. It may be hormonal. It tends to be perimenopausal women, I guess, that are the most symptomatic. So there may be like a
Mhm.
hormonal component to it. Um, um, but that's like symptomatic, right? If it comes to actually like objective measurements of temporomandibular joint dysfunction, I'd say it's pretty even between the sexes. So you'll see, in terms of like arthritic changes, remodeling changes to the joint,
Mhm.
um, clenching and grinding, wear, articular disc disorders, like people that have clicking, popping, crunchy noises and stuff like
Right.
that. I'd say it's pretty evenly distributed between the sexes, but definitely when it comes to, hey, I'm suffering, I'm having symptoms, how do we intervene? It's more common in women for sure.
Interesting. Mm.
Mhm.
Sorry, I didn't mean to just kind of throw that one at you, but
No, no,
it's like I remember reading this and it just
yeah, no, it's true.
always
Yeah,
wondered.
no, it's
Yeah.
true.
So on your website, and I'll put a link to it, for anybody that hasn't seen it, both to your website and to this particular topic, but you talk about the mind technique.
Yeah,
So for those who haven't seen the video, would you explain a little bit about this procedure and what the benefits are?
yeah, absolutely. So, um, most of my practice is treating jaws that are too small. That can happen again, like I said, in three dimensions, right? You can be retruded, the
Hmm.
jaws didn't grow far forward enough. There's also like angulation issues with the the, the angle in which your bite is and in your jaws grow. Those things we generally treat with corrective jaw surgery. There's another very common jaw deformity, which has to do with how wide the upper jaw developed. We call that maxillary transverse hypoplasia or maxillary transverse deficiency, which just means the upper jaw did not grow wide enough. That's something that's very commonly been treated in kids, put them in a palatal expander, before the sutures fuse, although they don't really fuse. It's more of an ossification where the bone kind of meets at the midline and starts to interweave like puzzle pieces. So it's not a true
Hmm.
like fusion. So in young kids, you can just use what we call like a tooth-borne palatal expander, like a Hyrax, and they can crank it, push on the teeth, and because the jaw has no fusion at the midline, everything kind of widens. Very
Okay.
easily treatable in childhood. And it's a very common thing and something that should be done much more often in childhood. Um, in adults, we traditionally did this larger surgery called the SARP. Stands for surgically assisted rapid palatal expansion. It's a surgery based off of a two-piece Lefort 1 osteotomy. So it's like a Lefort 1, same type of bone cuts that you would do to do a orthognathic surgery where you can move the jaw forward, except you're just making all those cuts and also splitting the palate down the middle so you have two halves of the upper
Wow.
jaw. And traditionally, you'd use, again, a tooth-borne expander, something that pushes on the teeth after you've made those two-piece Lefort 1 level cuts, and then you can widen an adult's jaw. Um, Also, good surgery, you improve people's airway, but it's a pretty big surgery in the sense that it's usually done under general anesthesia in a hospital. There's some dental side effects from pushing on the teeth where the teeth start to tip out. So we would have to overexpand people. Let's say we wanted to expand them 6 millimeters, we might overshoot that by 50%. So we'd like push them to like 9. And then we'd be like, okay, they're going to relapse back to 6.
Oh, okay.
So it was a big operation. There was flaws with it. It also, because it's a Lefort 1 level cut, you're widening the jaw at a very low level. So you're kind of widening at the level of the nasal floor. And maybe we can put in a graphic or something at some point, but
Yeah.
it's a low cut. You're kind of cutting from like the floor of the nose back. Do you want me to share media during
Yeah. If you've got
tonight?
something handy, yeah, that'd be
Let me
amazing.
let me open up a PowerPoint. I definitely have something somewhere. So let me see. Here we go. Maybe I need to connect to my external monitor. So here we go. One second. We can it's like mirroring the screen instead of giving me an extra monitor. One second. Let me fix this. Mm, it's never done this before. Why
No
today?
worries. That's all right. We can edit
It
that
never
out.
mirrors. It always gives me an extended display. I don't know why it's doing this. Here we go. Okay, here we go. Stop mirroring. There we go. Nice. Start mirroring. Um, just so- Can you see that okay?
There we go. Yep.
So this is the Lefort 1 osteotomy. So you can see we're cutting the entire bone all the way across at the level of the floor of the nose. So when we did surgeries that revolved around this, we do a two-piece. Again, we do a Lefort 1 osteotomy with a midline split. With a SARP, you use a tooth-borne expander like you would in a child, and you use the teeth as anchorage to push the bone outwards and get the tipping and the relapse and all that stuff. But you can see you're kind of widening just the floor of the nose.
Mm-hmm.
So patients that have a small airway, nasal airway volume, they get marginal improvement in their nasal breathing because all you're doing is widening the floor. It helps,
Mm.
but it's not treating the entire nasal cavity. You still get palate to widen, which gives you more space for your tongue, which is super important. but you're not actually treating the entire maxillary bone. The maxillary bone is actually really big. So this is actually the full maxilla. It
Hmm.
has a body, it has a frontal process, alveolar process, zygomatic process, and it dictates how wide the nasal cavity volume is going to be. Um, so what the mind surgery is, long story short, is a way to make the surgery more minimally invasive. So it's a surgery I do 95% of the time in my clinic, as if you were going to get wisdom teeth out. Do a little IV sedation. I free up the sutures in a few places. We use a special kind of palatal expander that is not tooth-borne, but is actually what we call bone-borne. So there's screws that go into the palatal bone so that when you're
Mm.
activating the expander and widening the jaw, you're actually pulling the bone apart and not using the teeth as your anchorage. And with that, you get three-dimensional expansion of the entire nasal airway. So I have a picture of that to show you as well.
And while you're pulling that up, I mean, what is the recovery time for something like this?
Yeah, so it's less than wisdom teeth. I guess wisdom teeth will
Wow.
be our barometer for everything
There you
today.
go. Yeah, because
Uh,
everybody knows those.
Yeah, so the surgery is done through three small incisions that are this big. You can think of it as like a laparoscopic procedure. We
Okay.
operate through these little ports, free up the suture, free up two sutures in the back, and then some other technical stuff we do in there to loosen the bone. And so very little pain or swelling. I mean, mild, maybe, very mild upper lip swelling, very little pain is usually 5 out of 10. I'd say most of my patients don't even take narcotics. They can take like ibuprofen and Tylenol and handle the pain. So it's like a very minimal surgery compared to a lot of other, I would say, oral surgery procedures. And the
Mhm.
type of expansion that you get is this like 3D expansion. So it's why isn't it showing there? Can you see that slide? No, it's not
Nope.
working. All right. Sorry for all the technical
No,
issues.
that's all right. So then, and then you
Uh,
said it's a Sarpy that you use. No, is that the same as like the Marpy or the Alpha or some of the others where you have to go in and adjust it periodically, or is it's just in there after the surgery and that's it?
so so just can you see the slide?
Yes. Hmm.
So this is the type of expansion we get. It's almost like a Lefort 3 level. It's full mid-face expansion. So the cheekbones come out. The blue is the after, the yellow is the before. So you can see
Oh
what actually
wow.
ends up happening. Your entire nasal cavity airway volume expands three-dimensionally. The palate still widens. You still grow alveolar bone. So a lot of patients that have crowding and stuff, like now you have space for the teeth. You don't have to shave down teeth to get your teeth straight. We have more bone at the midline. Palate widens. Nasal cavity volume three-dimensionally expands. And so all of that has a really big impact on the way you can breathe afterwards. I mean, after
Hmm.
just a couple millimeters, patients are like sleeping deeper, they're breathing easier through their nose, they're able to exercise with their mouth
Oh, yeah.
closed,
The
things that they were
triangle
never able
now.
to do. You
Yeah.
do not wake up with this gap. So um, it is a slow expansion. So we expand at a rate of about 2 millimeters a month. Sometimes we go a little faster, but let's say on average about 2 millimeters a month. So really slow, steady. And then once you get there, um, hopefully breathing and sleeping a lot better. Doing a lot of exciting stuff now where that gap that you saw in that post-op CBCT scan, we're actually controlling it during expansion. So, one of the things it was hard for people was dealing with a space between their two front teeth. We call that a diastema. It happens as the bone splits apart at the midline. Now, I'll tell you that patients that end up coming to me to get this done, these are patients that have not been breathing well, not been sleeping well. They're happy. They don't care because they're like, It's fine. It's gonna close. I'm okay. I'm breathing better. I'm feeling
Hey,
better.
it's
Who cares?
Madonna, it's in fashion. Let's just roll with it, right?
Yeah,
You can
exactly.
breathe.
It's yeah, but now we're able to control that gap during the expansion phase. So we're even taking that one temporary side effect out of the equation, which I think is making the experience a lot better and making
Yeah.
going through the procedure a lot more palatable for a lot of patients.
And then so they have to turn it though periodically. Is it
Yeah,
works like the
like
Marfies and everything?
one turn a day. Yeah, like little one we call it a swing, like one swing a day.
Okay.
Each swing is a twelfth of a millimeter, so it's just real slope. Millimeters this big. We're doing a twelfth of a millimeter a day, so it's just real slow.
And then once you get there, does it come out? Or
Hmm.
is this like
So
it
we
stays in forever?
it stays in for 6 months
Okay.
afterwards, because you have to wait for bone to fill in. So we expand and then we wait for bone to fill in, so it's permanent. Otherwise, if you remove the expander too soon, before the bone fills in, everything will relapse back to
Hmm.
where they were. So we expand, we hold, wait for the bone to fill in, then we remove the expander. But they're doing ortho during that time. So it's not like
Okay.
during that 6 months you're just waiting. You're doing ortho with the expander still in the mouth.
And is this one of those kind of things as you're expanding up here, then now this is going to start to follow forward, or do you have to do something separate to the jaw below?
That's a great question. So we are getting forward movement just with expanding, which is not the movement we are planning to do, right? We're planning to widen. But what we're seeing with everybody is that their upper jaw, as it widens, will come forward about a millimeter or 2 millimeters. Um, with that, we can also couple something called the reverse pull face mask. So we can add hooks to the expander and actually provide forward traction on the upper jaw. And sometimes, even in adults, push that another millimeter or two. So patients who may have been, let's say, 4 millimeters deficient in the forward growth of the upper jaw, just with the natural widening and coming forward a millimeter or two with the reverse pull face mask, we're bringing adults' upper jaw forward 2, 3, 4 millimeters, which is amazing for a minimally
Yeah.
invasive upper. The lower jaw, we're obviously not treating, so it's going to be more of an orthodontic thing, getting it to match where the upper jaw is. If the lower jaw is really set back, those are the cases where we're sometimes widening first, planning to do orthognathic surgery down the road. But
Hmm.
in a lot of patients, just the forward movement they get from the expansion and possibly with the reversible face mask, with the orthodontics to get the lower teeth to match is all that they're going to need.
That's amazing. So who is a good candidate for orthognathic surgery? I knew I was going to kill that. And is there a minimum
Orthognathic.
age for it?
So great question. So orthognathic surgery is a more precision surgery in the sense that we can really control the jaw in 3 dimensions. We can plan movements down to the tenth of a millimeter. We can fix orientational things down by the tenth of a degree. So, we can diagnose people, hey, your upper jaw should be 7 or 8 millimeters more forward. Your lower jaw needs to be 10 millimeters more forward. Your bite is too steep. We can flatten it out. We call that counterclockwise rotation, which actually opens up the airway some more. We can even widen the jaw at the time of orthognathic surgery. So we can actually segmentalize the Le Fort and widen the jaw and fix the bite. And during that time, we're also working on symmetry. So let's say your midline is off by half a millimeter, we can strain the midline so that your dental midline and your chin midline match up with your facial
Wow.
midline. There's a lot of beauty and precision in orthognathic surgery. Who's a good candidate for it? Insurance definition is going to be someone that has a functional issue, whether that is like chewing and swallowing issues, speech issues, airway issues like sleep apnea, um, people that bite their cheek or tongue because of the way their teeth align. And then you have to meet certain radiographic criteria. So we take measurements on x-rays and we show that the jaw is deficient by this much using this angle and that angle. And that's who would be a candidate. So minimum age is a great question. The textbook answer is skeletally mature, right? So for generally, it's going to
Mhm.
be 16 years old for a girl, 18 years old for a boy.
Okay.
However, in very extreme cases, okay? Like I just had a case last month of a 13-year-old who had really deficient jaw growth, who had severe sleep apnea, was not thriving, struggling in school because they're so
Mm,
tired and sleeping.
right.
That's a case where, you can make a decision like, okay, let's intervene now. All right. And understanding that because you're going to continue to grow, there may be a chance we have to redo the surgery when you're skeletally mature, right? Because you're going to wake up with perfect facial balance, perfect bite, right? That's how these surgeries are done nowadays in the right hands.
Hmm.
And you know, that's going to potentially change as you grow. So if it does not grow in harmony during the rest of your development, then when you're 18, we may have to do what we like call it just a revision surgery just to put things back to where they need to go. So
And this is more
textbook answer.
invasive, right?
Yeah,
This isn't like the mind technique. This is like
correct. This is like a
precision.
hospital surgery. It's a very precision surgery. So, we do it all fully custom now. So all the cutting guides where we plan the movements digitally, so I can see where all the midlines are. I can measure all the angles. I can decide how forward I want to bring the jaw, say 7.5 millimeters. I want to change this by 8 degrees. Yada yada yada. I want to move everything 1 millimeter to this side to make everything straight. We plan all of that digitally. We get cutting guides. The computer prints us cutting guides and also 3D prints
Mm.
us titanium plates
Oh,
so
wow.
that the surgery is done with computer robotic precision. Um, so the benefit of these custom orthognathic surgeries is one, the accuracy in the planning. You execute exactly what you plan because otherwise everything doesn't fit. But also it really speeds up the time of the surgery. So it's done in a fraction of the time that it used to be, which just means less pain, less swelling, less discomfort. The more time you're dissected, the more time you're in surgery, the harder the recovery is going to be. If you can speed
Sure.
up these surgeries, less time you're tractioning on the tissues and, doing all your stuff, you're going to wake up, you're not going to swell up as bad and have as bad of a recovery. But it is still a hospital surgery. We usually keep patients in the hospital for 1 to 2 nights. There's people that send people home the same night, and they're okay with it. It's not my style. I like to keep people a couple nights. I want to make sure that they're walking, they're peeing, their pain's well controlled, they're drinking enough, all that stuff before I send them home. And that usually takes about 2 nights, and then and it's great. I mean, people like in the old days, people go, "Are you gonna wire me shut? What is it gonna be like?" I'm like, "No, you're gonna have full mobility. You're not gonna have restricted opening.
Oh, wow.
The only caveat is non-chew diet for 6 weeks. So you're gonna be basically like blenderized smoothies,
Yeah.
milkshakes,
Liquids.
eggs,
Yeah.
oatmeal, yeah, oatmeals, the stuff like that for 6 weeks, and then get you back to a regular diet."
And when you're in there, I mean, you're not breaking bones, right? I mean, that may be a silly question, but you're cutting, not breaking. Cutting and moving, is that how that works? Or
It's a break,
it is a break?
but
Okay.
it's a precision break. So we cut the bone where
Hmm.
we want it to break, kind of like
Oh,
if you're
okay.
going to chop down a tree. So you
Yeah.
kind of create fault lines of where you want things to break, and then you actually break the jaw and move it to where you want it to go, and then plate it in that new position.
Wow.
It sounds
That's,
wild, I know, but
I know it sounds wild, like fascinatingly wild. That's really
yeah,
cool.
it
Yeah,
sounds
because it,
wild, but it works really, really amazing, especially with that new custom titanium hardware and the precision and the speed in which we can do these surgeries now. It's completely different than it was being done 5, 6 years ago. It's
yeah, that's
it's pretty
fascinating. Because
phenomenal.
in my mind, I'm thinking you're in there like, and then moving things around, and that just,
So
but the other
so
sounds really
like I
cool.
yeah, I mean like even the tools that I use to cut the bone is very different than what I used in my residency training, right? Like my residency training was literally kind of what you're thinking of in your head. There was saws and chisels and mallets and this and that. Now I use something called the piezo surgery unit. It uses ultrasonic vibrations to gently kind of cut the bone very precise, very delicately. The benefit of that is one of the things that runs through the jaw bones are nerves, right? Particularly nerves that give you sensation to your lower lip and chin. And one of the biggest side effects from orthognathic surgery is the risk of having permanent numbness to your lower lip and chin.
Hmm.
And when you use saws and chisels, it's a lot more traumatic on the nerve. And we would see about 20% of patients have permanent numbness on their lower lip and chin. And since switching to the piezo, it's so delicate and gentle on soft tissues while still allowing you to cut bone. I have no patients that are really fully numb anymore. Still, I'd say about 80%
Oh,
of my patients make a full recovery, but the 20% that don't, they all gain something back. So they gain about 50, 60, 70% of the feeling back. It just may not come back quite to what it was before. So it's
right.
very meaningful nerve recovery. Everybody gets meaningful nerve recovery now. No one has full numbness of their lip anymore. So even that has changed, night and day.
Dramatically.
I mean,
Yeah.
this is a specialty that if you're not on top of it, you become a dinosaur very quickly. It's changing very, very fast. So
Yeah. It sounds like
yeah,
it. And it sounds like it also improve recovery for the patients because it's
it
not
improves your
as traumatic.
Yeah, absolutely. It's a lot less traumatic. It's a lot more delicate. And it's even more precise, just being able to just gently cut bone and it doesn't touch soft tissues. It doesn't cut soft tissues. It's a game changer.
Wow. That is mind blowing.
Yeah.
So yeah, we talked a little bit about how you can move it just, a few millimeters here or there. Just kind of to put it in perspective for parents who may not have heard some of our other podcasts, maybe this is their first one. How can opening the airway, for your child just a few millimeters really impact their overall health span? And even just, not just down the road, but short term as well as long term.
Yeah, I mean, that's a great question. I love the word that you used, health span, right? Which is something I really believe in. It's not just how long someone lives, but with the quality of which they
Right.
get to live that life. It's huge. Um, I have the most rewarding job in the world. Like being able to treat people that are not their full self because sleep is such an integral part of brain and heart and overall just function and fix them, not just give them a band-aid, but permanently cure them by adjusting the jaws to where they should have developed to had they been a hunter-gatherer.
Right.
um, is pretty cool. For kids, I mean, I can't tell you how many kids we treat that, you know, ADD, anxiety, depression, whatever. And the root cause was actually their poor sleep, right? It wasn't they were just they weren't sleeping and this is how their brain was
Right.
responding to the lack of normal sleep architecture and not, struggling to breathe, anxiety of not being able to take a normal breath all the time, easy, deep breath through your nose like you're supposed to. So, if someone does have a child that does not breathe and sleep normally, that has any kind of abnormality in their jaws, the earlier you intervene, the better. And when they're young, it's so easy with early interventive or orthodontics, like little palatal expander, other kinds of appliances. You can really hopefully stimulate or actually promote the jaw growth to where you want it to go, and you can change the whole trajectory of their life.
It's
And
just
then hopefully they
amazing.
won't need orthognathic surgery.
Yeah. There you go.
Yeah.
Because
Yeah.
can't say it anyway. Uh,
Yeah.
so
Yeah.
I'll put links to some of the other episodes where we talk about some of the signs and symptoms you can look for because they don't always snore. Right. Some kids
Mm.
don't snore, but maybe they have restless leg or they wake up with headaches or late
Sleeping
stage
with their mouth
bedwetting.
open.
Yeah.
Mm.
So there's things like that. I know parents, and I'll put links to it so that they can review that. But you mentioned, being able to look at them. What are some of the things facially that parents could look at if they haven't necessarily seen any of the other signs? Just, oh, hey,
Yeah.
that's not quite right. That's not in alignment.
So jaw retrusion is going to be a huge one. If someone looks like their chin is really retruded or set back, that's a big sign. People that have maxillary transverse hypoplasia, people that mouth breathe, they
Mhm.
develop differently. There's very prototypical facial characteristics that you can see. Um, one of them is going to be a really deep palate. They may show excessive tooth show, so they may show a lot of upper teeth because the jaws have, you know, as it grows narrow, it can sometimes overgrow vertically. We call that excessive downward displacement of the upper jaw.
You mean like gummy
Um,
smiles? Is that what you're talking
kind
about?
of gummy
Okay.
smile. If you see any kind of open bite, so if the front is open or the sides are open, that's a big thing. Cross bites are a big thing. So if you see that, I don't know if you can see it on me, guys, but my upper teeth sit slightly wider than my lower teeth. A
Hmm.
lot of people that have narrow upper jaws, they'll have something called a crossbite, where the lower teeth will actually sit wider than the upper teeth. That could be a sign that the upper jaw didn't grow wide enough. Also, just looking at the palate should be shallow and broad and flat. If someone has a deep, high vaulted palate, slam dunk case, easy, easy.
Yeah.
So just look at your kid's palate. Does it look really deep? Um, and worst comes to worst, you just bring him into someone that's used to looking at those patients all day, and between a really good clinical exam, a good history, and a CBCT scan, we can diagnose people pretty clearly and see what's going on.
And I know I hadn't really prepped you for this, and this is an opinion. I'm just curious, what do you tell parents when they're presented with, oh, let's just pull a couple of teeth and put on some braces and they'll be fine? Or pull, even I've even heard, let's pull a couple of teeth and put on an expander. I mean, to me, I know the alarm words there, but how does that hit you?
Yeah. Um, you're ignoring a big puff of smoke that's coming out of your house. To me, it's if the kid doesn't have enough space in their mouth for their teeth, that's a red flag. Um, and I'm not saying you're going to make them worse by pulling the teeth and making their teeth straight, but you're not making them better. So make them better, make the jaws bigger, make the teeth fit, and they're going to be in a much, much better position. Is it a little bit more work to get a palatal expander as opposed to just pulling teeth and straightening the teeth out? Yes, but you're functionally going to change the kid's life forever,
Yeah.
as opposed to just covering your eyes and, oh, their teeth look straight. Okay, but how are they going to breathing? How are they going to breathe in 20 years? How are they going to breathe in 30 years? Are they going to, you're just kind of ignoring the problem, and you
Mhm.
have this beautiful clue, and use it and treat it. That's how I like to explain it to the parents.
I've
Something
actually never
along
heard
those lines.
anybody explain it as a beautiful clue, but it really is. It really is kind of here. It, it, it really is. Here's, if we can set your child up for a much healthier life
Yeah,
for something so
like life,
simple.
it's like life changing. Like
It is.
I
It is.
I use that word a lot, and I don't try to use it loosely, but it really is life changing. Like doing these little procedures where you widen the jaw or orthognathic surgery, it's life changing for people. Like you really completely change the way they breathe, you change the way they sleep, and thus they become better versions of themselves. And if you
Mhm.
can do that in a kid,
Right.
that's 30 years extra of enjoying that. Yeah.
Right. And I know there's some, then I can put some links to some of the things we've got in our resource center of linking airway and sleep dysfunction to things like dementia and
Hmm.
Alzheimer's, and they're starting to form connections. And
Yeah.
like you said to me,
Yeah.
that's a no-brainer. If
Neuro,
we can,
yeah. Neurodegenerative diseases, just like
yeah,
those, cardiac, like heart attacks, strokes, cardiac arrhythmias, like sleep
yeah,
is huge. Breathing is huge,
right. It's one of the
and
pillars. You can't do without it.
it's it's like the first thing that'll kill you.
Right. Right.
Yeah. Yeah.
Um, so one of the other things that we talk a lot about is this whole multidisciplinary approach just to medicine in general. I mean, not just to kids, but just overall. That it's not something that is taught in medical school or dental school. I know it's, let's silo, let's do our own thing, let's become the kings of our area. But you actually do advocate for this approach. So what was your journey? What brought you to this kind of a paradigm shift in your mindset?
I'd say I'm like I'm a pretty obsessive person, and trying to improve, whether it was coming up with the mind surgery or trying to stay state of the art with orthognathic surgery. I'm always trying to figure out ways to improve outcomes for procedures that I do. And obviously one of the ways is utilizing the technologies like 3D printed titanium plates, and right? But there's more to it, right? And one of the things that I got exposed to when joining the Breathe Institute in Los Angeles was their multidisciplinary approach to tongue tie surgery. People that had tongue ties, they would couple it with myofunctional therapy, and they improved the results of doing a frenuloplasty. So people that get tongue tie surgeries, instead of getting their surgery, feeling good for a day, and then scarring back down to where they were because they didn't have the proper tongue function and mobility and strength and range of motion and all that stuff, they coupled it with that kind of therapy and improved the results. And I was like, okay, I think that would be very beneficial for orthognathic surgery as well. I was like, all of these patients have oral myofascial dysfunction.
Mhm.
Um, these patients, they're generally adults who have not been sleeping well for 20 years. Their mind body connection is all out of whack. I'm like, I want to bring in a yoga nidra, mindfulness meditation counselor to work with them before the surgery. So they come into it with the right mindset. I mean, you're about to heal, you're about to experience all these changes. You wake up from these surgeries breathing better. It's not like, hey, we'll
Mhm.
see you in 6 months. Give it 6 months.
Right.
It's like you
You wake
wake
up.
up breathing better. So I want to get their mind ready for all these changes that are about to happen. So myofunctional therapy as well, working on their breathing patterns, working on their tongue tone, their tongue posture. They're going to have more tongue space when I lengthen the jaws. I want them to use that tongue space to the max. What's the point of having a giant mansion if you only sleep in one of the bedrooms?
Right.
I want them to use the whole house. So have them work with a myofunctional therapist to get the most out of the space that we're creating, to work on their breathing patterns, because these patients were, you know, using their accessory muscles to breathe for 30 years, and they don't know how to breathe through their nose well. And so working with a breath worker and a myofunctional therapist, mindfulness and meditation. And then again, we talked about the diet, 6 weeks not being able to chew food. So I want to make sure your nutrition is up to par, because
Mhm.
you're healing. You're going to be like an anabolic growing kid. You need more protein than usual because you have to heal all these tissues.
Mhm.
Um, Everyone has their own, diet. Some people don't eat gluten, don't eat dairy, da da da. So you want to make sure that we're finding nutritious diets where they're getting all their macro, micronutrients, but it's also interesting. So you have some meal plans where I like these kind of flavors. Okay, let's come up with a blended thing that will be interesting to you so you don't get bored after 3 weeks and you're just like, oh, I can't do
Three
this
weeks of
anymore.
oatmeal, right?
Yeah. And then just, these cases are multidisciplinary by nature. There's me, there's going to be an orthodontist usually that's going to be finalizing the occlusion, making sure everything fits beautiful. We don't want you just to have a beautiful face and a beautiful airway, but we want your bite to be really beautiful and functional as well. So the orthodontist is a big part of that. The general dentist, having them as part of the team so they can quarterback any restorative stuff that may need to be done. And then I just have a pharmacist on board as well. Obviously we have a big opioid epidemic in the country.
Hmm.
The last thing I want to do is just shove narcotics down patients' throats. So we work on multimodal pain management, where we're not just giving them narcotics, but we're, maybe adding some CBD and other things that can help lessen the pain burden. So we're not just relying on opioids to control patients' pain. And together, this team has really like taken the surgery, which on its own is life changing, like I said, and now we're getting way more out of it, and the experience is way, way, way more positive.
Yeah, that's amazing because it really is. It's a lifestyle change as well,
Yeah,
right?
absolutely. Yeah.
Yeah. So, at the end of every episode, I always hand the floor back over to the guest, as the expert for the final thought for our parent audience. So I give you this option or this opportunity now.
I'll keep it short and sweet. So I
Okay.
think, to summarize, intervene young, If you see signs of abnormal breathing, abnormal sleep, orthodontist tells you, hey, let's pull a couple premolars out and strain their teeth. Anything like that. The jaws are too small. Intervene while they're young. It's super easy. It's going to change their life forever. If you're a parent yourself that is having these issues or some adult, just know that we live in the golden age of treating these things now. And it's really safe. It's very predictable. Things are much more minimally invasive, much more precise. And it's a good time to get it done if you need to. And yeah, I think that kind of summarizes my gist in life right now
Love
and how
it.
I
I
treat
love it.
people.
Well, thank you so much for coming on today and for sharing all this. I really appreciate it.
No, thank you for having me. It was great speaking with you.